Good afternoon, Wave Country. I'm John Ramsey, and welcome to the Wednesday edition of Wave 3 Listens Live. If you are a denture wearer, or perhaps you have a loved one who wears dentures, then you're probably very familiar with how much of a hassle they can be. You can't eat the foods that you love. They're ill-fitting. You're not confident in your smile. You have to carry all that glue with you. There's just a grocery list of reasons that you need to know all about Freedom Mini Dental Implants. And with me now is Dr. Reagan Ackerman. Dr. Ackerman, welcome back to the show.
Thank you. Nice to see you again.
You know, and it's not just denture wearers, but I would think that a lot of your business is people who just want to throw away their dentures.
For sure, yes. We can get rid of the denture completely. We can do permanent teeth with the mini implants. The great thing about the mini implants is it's a lot less invasive, usually about half the cost of surgical implants, and we help out those people that were told they weren't candidates for implants before, and they want to get rid of that denture completely, or as you mentioned, they don't want to deal with denture glue, and they're just tired of worrying about their denture falling out all the time.
Yeah, and some of the effects of wearing dentures, I mean, there's some serious health issues here in that, okay, let's say you can't eat the foods that you like, and most of those foods are nutrient dense.
Yes.
They're fibrous, you need the fiber, and you tend to eat things that are soft, and so there's that issue. And then also I think there's the issue of if you're not confident in your smile, you tend to kind of cocoon.
For sure.
And you become antisocial, and that's not good either, right?
People become prisoners of their dentures or their teeth because they don't want to go out in public. And I hear it time after time with patients. They're embarrassed to go out. Embarrassed to go out to eat with family members or smile in pictures or go to family functions.
Sad.
And it is. And we don't want people to be prisoners of their dentures. The mini implants is a great option for people. It gives them that confidence back. They know their denture is going to stay in nice and tight and secure, or they can get rid of that denture completely. So
before we go to our patient today, and I love when you bring a before and after picture because the proof's in the pudding, and wait till you see Teresa. You're going to love these. Okay, we're jumping in there. That's good. Okay, this is Teresa, and I want you to see the before and the after. Tell me a little bit about this patient.
Teresa, wonderful, wonderful patient. She came to me like many denture wearers, struggling to keep her denture in. She hated wearing it. She pretty much only wore it to work. She told me the first thing she did when she walked through the door was pop her denture out, like just spit it out because she hated wearing it so much. So we helped her out with the snap-in dentures, and there she is smiling and happy.
Look how much, and much younger looking. It's amazing what teeth can do in terms of your age, because literally 15 years younger. If we could do that again, that before and after, oh, there we go.
Yes.
Look at the difference.
Yeah, and she told me, talked to her a few weeks ago, and she's like, I just have so much more confidence now. And as you mentioned, she said she can eat a lot healthier. She can eat pears and walnuts now, things that she couldn't eat before. She said she enjoys biting into a hamburger again. She, was always scared to do that out in public. And then she had to retrain herself because she said the first time she walked in the door, she tried to spit those dentures out. And with the snap-in dentures with the mini implants, she couldn't do that. They didn't come out. And she was like, I was so used to that. Now I can't get them out, and I love it. So.
Well, Teresa, you will become accustomed to that beautiful smile that you now have. And here's the beauty of it. Okay, there was the old method, and this is why I think the show really works so well, is when you have something that's really revolutionary or something that people aren't aware of, and they find out that it's less costly, that it's less invasive, less downtime, all of these different positives, then people get excited about it. I'm very excited about Freedom Mini Dental Implants. Okay, so if you would, show people, and let's talk a little bit about the difference the way it used to be done and the way that you do it now.
Okay. This model actually kind of shows it very, very good, kind of the difference on how minimally invasive these mini implants are. Because I no longer have to do incisions or stitches.
So this is a jawbone?
Like that. Yeah. So imagine, this is, your lower mandible, your bone, but this little tiny hole, I don't even know if you can get it, see it, that's the hole I make when I place a mini implant, okay? So a lot less invasive, whereas this big hole is the surgical implant way, where you're talking surgery, incisions, stitches, got to heal up another 4 months after they place it, go into different, different appointments and dentist versus this minimally invasive way with this little tiny hole. So that's a huge difference right there. We're not taking away as much bone, and it kind of shows you that we don't have to have as much bone. So those people that were told too that they weren't candidates for implants, I can help them out because I don't have to have as much bone. I just need some bone. don't have to do bone grafts or sinus lifts or kind of all that scary stuff that either people couldn't afford or they were just kind of scared to do. With the mini implants, we don't have to do that.
Yeah, it's interesting because before it was such a process. There was, you know, the actual surgery. You'd go to a surgery, you'd be cut open, and it was all this long process, and it was very invasive. And now it's just, you're just numbing the gums, right?
Just numbing the gums, making a tiny little hole, and screwing that little implant in. I kind of relate it to, you know, laparoscopic surgery now versus being cut wide open. So it's a totally different ball game. And this technology has been around for many years. Yeah, 15, 20 plus years. And that's the thing with a lot of denture wearers. They may not have been to a dentist in 10, 15 years. True. And they may not know that this new technology is out there as an option.
And that it's less costly as well, because, I mean, everyone has a budget, and yeah, you'd like to get rid of your dentures, but you're thinking to yourself, how much would it cost me? From what I understand, and I know in all cases we can't be very specific because you don't know what the needs are, but for the most part, what are we talking as far as savings as compared to the old method?
I mean, I can tell you, compared to the surgical method, the mini implants are about half the cost. So usually if somebody comes in with a quote already from, you know, for the surgical implants, our quote is about half the cost of that. So yeah,
wow,
big difference. And that's what we're there for, to make it affordable for people too. And we do have financing plans as well if somebody needs that, but it usually is a lot more affordable than the surgical implant way.
So really, I've researched it, and usually when something sounds too good to be true, it usually is. Not in this case. There's really no downside. Less costly, less invasive. I mean, you can walk out next, you're ready to rock and roll. And it's not just about people with dentures. If someone is missing a tooth or two, or perhaps they want to get rid of a bridge, you deal with those clients as well, right?
Yeah, there's a lot of people out there struggling wearing a partial, just replacing a couple teeth. Definitely can do single teeth or 2 or 3 teeth, multiple teeth, or get rid of that partial. Some people are born without certain teeth, and we can help them out too. In a lot of instances too, they may have been told they didn't have enough space or enough bone, and you know, for that one single tooth. And a lot of times I can do the mini implant there and help them out. So.
In the next segment, we'll show you a little bit more how it's done. We have some models here, but I wanted to ask you, what do you find to be the case now? Is it more people who want to feel confident in their smile, or is it people who miss the foods that they love, or is it a little of both? Is there?
I mean, it's definitely a combination of both, for sure. But I would think, you know, everybody wants their smile, but honestly, I think more importantly, people want to be able to chew and eat and have confidence in their teeth is the biggest thing. So.
Yeah, I would think, you know, the part of it you mentioned when people become a little antisocial, and I would think, you know, to be able to go to a party and looking forward to wedding pictures and celebrating with your family, that it really affects everyone.
Yes.
Because your loved one wants you at the events. They want you there, and when you're saying, you know, or you're covering your mouth or you're not confident, they feel that. And then it's like, we want you to enjoy yourself. So I would.
And I can tell a difference in my patients and their personality and their confidence when they, you know, have teeth they're confident in. I mean, they just exude confidence and smiling, and it makes me happy too. So it's very rewarding, very rewarding.
If I can have teeth that look like yours, I'm in. Okay, so let's show, before we go to break real quickly, Teresa before and after. If there are any doubts, any apprehension, there we go. That really may be what makes you go, hey, I'm going to take some action here. Like you said, whether it be a bridge, a partial, dentures, a tooth here or there. Look how much younger she looks. And yes, I see the confidence. You know, in that picture on our right here, I see the confidence. Okay, coming back here, we'll tell you more about Freedom Mini Dental Implants. You're more than welcome to give us a call. We'd love to hear from you. If you have a question about you or a loved one, 571-5263. I have the expertise of Dr. Reagan Ackerman. We'll be back. It's the Wednesday edition of Wave 3 Listens Live.
Wave 3 News is neighborhood news happening now.
I'm going to step out of the way so you can take a look at this. No one was hurt when that barge clipped the overlook.
A massive house fire in Louisville tonight.
Several people rushed to the house.
Breaking more local stories.
A very rocky start.
Still a very active scene this morning.
They actually heard multiple gunshots.
With alerts to what's happening around you at all times. When news is breaking, thank you for trusting Wave 3 News. More local now.
Hurt in a car? Call Sam Aguiar.
When you're injured, here's what to look for in your lawyer. Someone who fights for you like they would their own family and has earned a reputation for winning big cases. I'm Sam Aguiar. We're proud of every verdict and settlement we've won because of the difference it's made in our clients' lives and the difference it could make in yours.
Hurt in a car? Call Sam Aguiar. 888-8888.
Welcome back. Freedom Mini Dental Implants, Dr. Reagan Ackerman. And you know the phone number, 571-5263. Do you know this is the longest running, continuous running talk show in the city?
I did not know that.
Yeah,
no.
Wave 3 listens. Very proud of that.
Congratulations.
Yeah, well, thank you. And you're a big part of that because you're a frequent guest.
Yes.
And it's a very popular show because I think there are a lot of folks out there who are not completely happy with their smile. If you happen to be one of them and you have a question about the process, then she will field those calls. Now, let's show, you have a couple of different methods.
Yes.
Yeah, and so really the choice is yours, but both of them are going to save you money, and you can either go permanent teeth or have your current dentures more secure to where you don't have to mess with any of the glue. You can be confident in what you eat. And show us how it works.
Yeah, so I'll start with the snap-in denture, okay? So this is, you know, it's still a denture, but for those people that struggle and they're going through tubes of that glue and they're afraid, you know, if you sneeze, your denture's going to fall out, this is an option for you, okay? So what this shows, you know, imagine, here, I'm going to set this down for a second. Imagine this is your mouth and your gums.
No plastic, right?
Right, no plastic. This is, the pink part is your mouth and your gums, okay? And then what will happen is you'll come in. I'm just going to numb you up with a little Novocaine. Don't have to put you to sleep, sedate you. It's minor, minimally invasive. And I'm not making any stitches or incisions. I'm just make a little tiny hole and place these implants, okay? Now, the day I place the implants, and this is a big difference between the mini implants and the surgical, you will leave that same day with your denture, let's see, with the denture snapped in on top of these implants. So then, the day I put the implants in, you leave with a denture that is secure. You are no longer using denture glue. You don't have to worry about it falling out and things like that. So this is the snap-in denture route.
Now, for those who have dentures perhaps they've had, as you mentioned, 15, 20 years, and they're not really happy with those, can you make dentures for them to fit?
Definitely, yeah. Yes, yeah. And I'd say majority of the time we make people a new denture because they're not happy with their denture or they don't like the way it looks and things like that. So sometimes we can use their existing denture if they're happy with that one. But I'd say majority of the time we're making, you know, a new denture. We'll do a try-in, make sure they're happy with it, and then we'll, you know, place the implants that day. You know, no stitches, very minimal bleeding, actually no bleeding really. That's a question we get a lot because there's a lot of people on a lot of medications and blood thinners. I don't have to take anybody off of any medication or blood thinner or anything because there's really no bleeding.
Now this method is really cool.
Yes.
This is like having your teeth back. This is a whole new set of teeth. Show them exactly how this one works because I love this.
So this is kind of what we call the permanent teeth, okay? And this is...
Again, this is your mouth, right?
This is your mouth, the pink, and then same process as far as putting the implants in. No stitches, no incisions, very minimally invasive. We're just going to put more implants in. But then we can make a permanent bridge of teeth, and you get rid of all the bulkiness of that denture. Yeah. You no longer have anything covering the roof of your mouth, all the bulkiness on the outside, and it is permanently cemented into your mouth.
They get a little irrigator to clean them, right?
Get a water irrigator to clean it, and brush it like your normal teeth, and it's the closest thing, you know, to having your natural teeth back, and it just cements on to all those implants. And it's permanent, it's strong, it's the nicest thing we do for people, definitely.
I love that.
So.
Okay, and Dr. Ackerman, now, for those we were talking about bridges, partials, a few teeth here and there if you have an issue there, you know, maybe it was a sports accident, you had a tooth knocked out, and you want to show us how that works.
Yep, definitely. So as we mentioned, we can do single teeth. So this kind of just shows, you know, we can do one tooth. So, you know, same thing, just a little Novocaine, place that implant. You'll leave the day I place the implant with a temporary that, you know, looks like your front tooth. And then a couple weeks later, you get the permanent tooth, and it cements on. And then you no longer either, a lot of people have what we call little flippers or partials that they struggle with and popping them in and out. So you'll get a permanent tooth there. And same thing if you're missing, you know, 2 or 3 teeth. So if you know, have a gap here or you've been wearing a partial that you hate, we can get rid of that. We're going to place these little mini implants. And then the same day we place those implants, you'll get a temporary. A couple weeks later, you get these teeth cemented on there, and those are permanently cemented on. They're staying in your mouth, not coming in and out. You no longer have to worry about a partial or anything like that. And these are a lot of instances where somebody's been told they had to have a sinus lift or a bone graft, or or they just couldn't afford a surgical implant. These are the people that I help out every day with these mini implants.
I always like hearing about, the after and the results and how excited people are, because really you're changing people's lives. Because we talked about, the lack of confidence, the inability to eat the foods that they love, the being antisocial. So what kind of reviews do you get from people after they have had this done?
They can taste their food better. That's a big one. They no longer have to use all that denture glue. Just more confidence. They can eat the foods they want to eat. Peanuts and pretzels. And I had my patient today, his favorite thing was a taco salad from Wendy's. And believe it or not, just things we take for granted, like chewing lettuce, sometimes people struggle with. And that's what he was, looking forward to and could do again. So, yeah, definitely. So I know Dr. Stroud used to always joke he never got a hug for a root canal, but I get hugs all the time.
Yeah, that's nice.
This, so.
I could see where you'd want to change, your dentistry and your focus, because here, like you said, this is all positive.
Yes.
This is making, changing people's lives for the better. Like I've had a couple of root canals, 2 of them, in fact, from a sports injury. No fun.
Right.
Yeah, those are no fun. Now I know why they use that when they talk about pain.
Yes.
So let's go to the phones. 571-5263. I talked about the patient experience, and I think we have a caller who has been a patient of yours. Greg, welcome in to Wave 3 Listens Live.
It's Greg.
Hi, Greg.
How you doing?
Oh, Greg, you have a comment?
I've seen Reagan on your show many times, and I always tell her I was going to call in after my session was done with her. And everything she preaches to the fact that many dental implants is dead on.
So it's true. This is you, right, Greg?
Yes, that is me.
Well, Greg, you're a handsome individual. I hope you don't mind me saying that.
No. I was over almost 18 years without dentures.
18 years without dentures, you say?
Yes.
Yeah, he had no teeth. And correct me, it was from a car accident when he was younger.
Yes, it was.
And he couldn't wear dentures, so he just gave up, and he went without teeth for 18 years. And then he found me and came to me, and we did the mini implants, and now he's wearing his teeth and happy, right, Greg? I remember peanuts was what you wanted to eat the most, right?
Yeah, it was. Extremely happy with them 1,000%. And one day I will get back to have them permanently mounted.
So Greg, tell me about how your life has changed, because I think it's obvious visually, and that's not going deep enough. I want you to tell me about the confidence factor and how you feel when you go to parties and events. Tell us about that, Greg.
I never went out.
Oh, that's sad.
I rarely would go out, and I got a beautiful wife now that loved me before and after with them.
There you go.
Yes.
I have a wonderful group of friends that accepted it no matter what. It makes a big difference. People that are around you accept you how you are, and of course I could eat literally anything I want to now.
What about your confidence, Greg? I mean, your loved ones. It sounds like you're surrounded by people who genuinely love you, Greg. Yeah. But what about your confidence in going out now? How do you feel?
1,000%.
There we go.
You don't know how bad you really miss it until it's gone.
Wow.
And once you get them back, it's like you've never been without them. And people look at you totally different when you have teeth.
Greg, would you mind, like, the process, when we put the mini implants in? Because I know it's that unknown factor of, like, oh, my gosh, this is going to hurt so bad, and da-da-da. Can you kind of maybe help the viewers out there, since you have firsthand experience with that?
Okay. Actually, we started early one afternoon, and actually spent, I believe it was, 3 hours in a chair.
Right. Yes.
And at the end of that 3-hour time, I literally walked out with what you see on TV now.
Yes.
Wow.
Yeah.
Wow, that's amazing.
The pain factor, you always hear people talk about it. The pain factor isn't there. It's like having on my experience, say having a tooth pulled. Just that pain for maybe a day or two, then it's gone.
And as far
as very little pain.
And the procedure was just a numbing of the gums, correct, Greg?
Yes, it was.
Wow.
I'm so glad you called in,
Me too.
Greg. Thank you.
I've been meaning to, and I actually work third shift, so I just got up to get a bite to eat real quick, and I saw your picture on the TV. I was like, I'm gonna call in.
I appreciate it. Thank you so much. It's good to hear from you. Oh.
Doesn't that confirm that you're in the right business? I mean, that you're doing something that,
It gives me warm, fuzzy, yeah. It just makes me happy, yes.
The warm fuzzy is a good thing. And Greg, I'm happy for him because he said, I just didn't go out. I just didn't. Right. And he said his life has changed 1,000%. But I do love this too. I mean, and I'm not trying to say that this isn't the case for most everyone, but your loved ones are your loved ones.
Definitely.
With or without teeth, you know, no matter what the issue happens to be. But isn't it nice to go out in a room full of strangers or in a social situation and say, I feel good about myself?
Yes.
I mean,
and have that confidence.
Yeah.
Yes,
a lot
definitely.
to be said for that.
Yeah.
So peanuts were Greg's thing.
Peanuts were Greg. I remember his wife the day we put. She's like, I have a jar of peanuts waiting for him at home. So,
fantastic.
Yeah.
Well, Greg, thank you for calling. Yes. If you have any questions about the procedure or Freedom Mini Dental Implants, 571-5263. Quick break, and we'll be back on the other side on Wave 3 Listens.
Hey, need help with your down payment? Tim Jones back for Toyota of Louisville. Right now, a totally reinvented Camry with Toyota Safety Sense and Toyota Care Standard. Get $1,000 customer cash back at Toyota of Louisville, a Swope dealership where nobody walks away.
People often ask me, how much money do I have to pay you up front to be my personal lawyer? The answer is nothing. It's free unless we win. What about a slip and fall or car crash case? Free unless we win. We have recovered billions in settlements and verdicts over the years. We have never taken a fee unless we've won the case. Our service is free unless we recover for you. You can hire the largest personal injury law firm in the world as your personal lawyer for free unless and until we recover for you. Morgan & Morgan, forthepeople.com.
It's all new and it's here. I'm Tim Jones back for Toyota of Louisville. We're talking about the 2019 Toyota RAV4. Come down and take a test drive and experience all the new innovations. Toyota of Louisville, a Swope dealership where nobody walks away.
Once again, Freedom Mini Dental Implants. Dr. Reagan Ackerman is here, and Dr. Ackerman, I think it's important that folks know that, you know, free consultation, if you're not one of those who likes to jump on the phone and talk, they can have a private consultation with you, right?
Yes, definitely. It's a free consultation. I'll do an exam and kind of see what their options are, and sometimes we'll do an x-ray, and that's no charge too. Sometimes it's a 3D x-ray, no charge. We just want to make sure we're, you know, given all the right information and have everything. So yeah, it's a free consult, so you're not out of anything, not losing anything just by coming and talking to me and knowing what your options are and seeing what the costs are and see how we can help you.
Let's talk a little bit about demographics. So how young, how old?
It's all over the map. I mean, I just did a young 20-year-old a month ago. He had been through braces and got gaps and everything, so we filled in where he had been missing some teeth. Done them on a 90-year-old. So yeah, I mean, people are living longer and they want to eat what they want to eat, and you know, even if they're in a nursing home and things like that, they want to be able to eat and enjoy, you know, the remainder of their life and their days. So yeah, young, old, I mean, we don't discriminate against age by any means. If you need something or want something, we can help you out.
Yeah, and don't be hesitant because you're embarrassed, because a lot of times, you know, teeth deteriorating or having to be in dentures, it's genetic. I mean, there's a lot of times when you can take very good care of your teeth and you just have an issue, right?
See it all the time. People go to the dentist regularly. They do everything they can. I get a lot of questions about, oh, I have periodontal disease or bone loss. I don't think I'm a candidate. More than not, a lot of times you still are a candidate for the mini implants because, like I said, I don't have to have a lot of bone, just some bone. So, you know, some people, you know, don't come in because they don't think it's for them because we're told they had periodontal disease. But a lot of times I can help those people out.
Yeah, I think it's important for people to know. It's very rare, isn't it, that you tell someone no?
It is very rare, yes. I'd say like 2% of the patients that come in, I have to tell them they're not a candidate.
Wow.
So it is very, very rare.
Yeah, so more than likely she can help you, or as I've mentioned before, help a loved one, help you like she helped Greg, like she helped Teresa, and you've seen some of the before and after pictures. 571-5263 if you'd like to give us a call and you do have questions. Something that we hear often, I think, yes, the confidence, you know, But that glue thing too, that can't be healthy.
No, it's not healthy.
Yeah, tell me, because you have to. I mean, it gets in your saliva, which I would think would mean it gets in your blood system.
Yes,
true.
True, definitely. I think there were studies about the amount of zinc in it and things like that. It is not healthy to have in your mouth at all. Not to mention the cost factor. I mean, I have patients that say the amount of money they spent on denture glue in a year could pay for their staff denture, basically, because they're going through a tube of it a day. So yeah, it's not healthy to be using all that denture glue. So definitely come for the free consultation. Let me so you don't have to use that glue anymore.
Okay, and where are you guys located? We'll put up the information on the screen for those who'd like to just call and go ahead and make an appointment for a consultation, but here we go.
So Dixie Hwy, which I know is a long road, but the easiest way is right across from Valley High School. So it's more towards the Gene Snyder, right there on Dixie Highway across from Valley High School. So yeah. So.
And we were talking about reviews and what patients say. How often do you hear this? And I'm guessing it's pretty often. Do you hear people say, I wish I would have done this earlier?
Yes, I do. And one patient comes to mind for sure because she'd had dentures for 20 years. And she came in and we did the permanent teeth, top and bottom. And she was like, I wish I had found you 20 years ago. And that's why I do shows like this for people to know about it, because a lot of people don't know about it. Their dentist isn't going to tell them about it, or they haven't been to a dentist in 10, 15 years to know that this technology is out there. But lots of patients say, I wish I had found you sooner, for sure.
So if you'd all but given up, or perhaps, as you mentioned, Dr. Ackerman, maybe you're out there and you're going, hey, I was told I wasn't a candidate. Well, go in for a consultation if you would. Again, Freedom Mini Dental Implants. We'll be right back to tie up the show on Wave 3 Listens Live.
Don't let a friend or family member suffer. If you witness any form of nursing home abuse, call the Winton and Hestand Law Group. Our professionally trained staff will stop any abuse and help your loved one get the justice they deserve.
Winton and Hestand?
Real lawyers, no gimmicks.
Apply for disability? Already lose? Did you lose your job over your medical problems? The safety net, it didn't really catch your fall. Are you prepared for the fight? The government has more resources than you, which is why you need a lawyer who's lived in the trenches and fought his way out for over 25 years. Don't just get mad, get me. Pick up the phone, call me. No, really, call me now.
Call 888-587-0228. Call now.
There are 2 million trucks on the road daily feeding America's commerce. There are also a 40-ton missile, and 1 in 4 will be involved in an accident. If you're involved in a semi-truck related accident, call the professionals at Winton and Hestand Law Group.
Winton and Hestand?
Real lawyers, no gimmicks.
It's the Progressive Louisville Boat, RV, and Sports Show. 60 years, Kentuckiana's biggest boat and RV sale. That happens, it's going on right now through Sunday at the Kentucky Expo Center. More than 500 boats, RVs, and over 200 exhibitors. If you'd like to go, well, you can check out the hours. You can go to LouisvilleBoatShow.com, or you can be the third caller right now, 888-800-9283, and win tickets. Before we go, I'd like to thank Dr. Ackerman. Dr. Ackerman, thank you very much.
Always a pleasure. Thank you.
Making Kentuckiana smile. That's what they do at Freedom Mini Dental Implants. Have a great day. Stay dry, and we'll see you tomorrow right here on Wave 3 Listens Live.
If your loved